Hey everybody, welcome. My name is Harper Byers and I work for the School-Based Health Alliance. I am really excited to welcome you all to our Be the Change session, Self-Advocacy in Sexual Education and Reproductive Health in Marginalized Communities. We would love it if you could turn on your cameras and join us today, but know that it is not required. And with that, I will pass it to our lovely presenters to get us started today.
Hello, everyone. There we go. Okay, the screen has been shared. So this is, like Harper said, the self-advocacy in sexual education and reproductive health in marginalized community, led by Lane and I. I'm Lauren, and then little introduction. My name is Lauren Metcalf. I live here in Portland, Oregon. I use she, her pronouns. I am 16 years old and I will be a junior in high school next year. And just a little bit about me is I'm a school-based health advocate here in Oregon, and I'm also the creator of the All in My Head podcast, as well as a Planned Parenthood Teen Council member. And in my free time, I row crew, which is pretty exciting. And yeah, other than that, I'm pretty much just another teenager.
And hey y'all, my name is Lane. I'm also from Portland. I'm 17. I'll be a senior in high school. I also co-created the All in My Head podcast with Lauren, which was super fun, and that's still going. So check it out on Spotify. And then I'm also a part of the Multnomah Youth Commission here in Portland, which is a super cool organization that does a lot of youth advocacy. And then I was also a student-based health advocate over the last year. So I got a lot of experience working with school-based health centers and doing advocacy around that, which was a whole bunch of fun. And as you can see, I love hiking. This was at the top of some ridge in Port Angeles. So yeah.
Do we want to let's just go around the room and I'll just give everyone a second, just popcorn to share your name, pronouns if comfortable, as well as your age and where you're from. So whoever is okay with introducing themselves first, just go ahead, just popcorn style.
I can go. So my name is Chris. I use he, him pronouns. Is that it?
Then your age and where you're from.
Thank you. Sorry, I completely slipped right out of my mind the second I started talking. I am 21 now, and I'm from Novi, Michigan, and I'm also a member of the Youth Advisory Council. I will popcorn to Audrey.
Hi everyone, I'm Audrey. I use she, they pronouns. I am 20 years old and I'm from Peabody, Massachusetts. I go to school at the University of Massachusetts and I am a member of our Youth Advisory Council. I'll popcorn it over to Bila.
Hi, my name is Bila. I use she, her pronouns. I'm 20 years old. I'm from Hagerstown, Maryland originally, but I go to school in DC. And I'll popcorn it to Brooklyn.
Hi, I'm Brooklyn. I am 20 years old. I'm from Bryant, Arkansas, and I'm a member of the Youth Advisory Council as well. And I am going to popcorn it to Christine.
Hi, I'm Christine. I'm 13 years old and I'm from Everett, Massachusetts. Oh, and I'll pop on it to Harper. Hi, I'm Harper. I'm 24 and I work for the School-Based Health Alliance. I live in New York City, but I'm originally from Seattle, and I'm happy to be here. So I will pass it to Marie. Marie, you can feel free to use the chat as well if you prefer to introduce yourself that way, totally fine. And I believe our last one to share is Sieta.
Yeah, Marie just said in the chat that it's noisy, but their name is Marie. They use she, her pronouns, and they're 17.
Awesome. Thanks for sharing, Marie.
All right, so my name is Sierra. I'm 21 years old. I use she, her pronouns, and I'm from Omaha, Nebraska, and I'm actually interning at SBHA, and I'm so happy to be here for the program.
And I think that is all for introductions. Thank you everyone for introducing yourself. So we'll just hop right into it. So to get started, we're just going to go over how marginalized communities have been impacted in the past. The first one is they've had a harder time receiving reproductive health care, including abortions, birth control, STI testing, and many more. And then inequitable health care practices and just generalized discrimination in healthcare settings and lack of gender affirming care. Misdiagnosis of mental health issues and illnesses have also been a big one. And then historical mistreatment of BIPOC communities. Tuskegee, heredolax, and forced sterilization are just a couple examples. We'll go into those next. Here's a couple of explanation and examples of places we've seen this. The first one is Tuskegee, which is a study of untreated syphilis in the Negro male. It involves 600 Black men, 399 with syphilis, 201 who did not have the disease. And with this study, informed consent was not collected, and researchers told the men they were being treated for bad blood, a local term used to describe severe ailments, including syphilis, anemia, and fatigue. And in exchange for the uninformed consent that took place, the men received free medical exams, free meals, and burial insurance as essentially bribes to participate in this study. And then another big one that happened in the United States and took place in 32 states all throughout the 20th century is unwanted sterilization and eugenics programs here in the United States. And this was used as a means of controlling undesirable populations, such as immigrants, people of color, poor people, unmarried mothers, the disabled, and the mentally ill. And this was driven by the prejudice notations of science and social control. And these programs informed policies and segregation. And then the last one is the dark history of birth control. This was done in Puerto Rico, where women of color were used as guinea pigs on birth control trials in the early 1950s. And this program was federally supported by the government in Puerto Rico as a form of population control. And this resulted in 1/3 of every married woman aged 20 to 49 being sterilized in Puerto Rico by 1965, with 2/5 of them before the age of 25.
So now that we've gone over a little bit about the history of how marginalized communities have been affected by a lack of reproductive health care and the like, we want to do some small groups where we can learn from each other. Because one of the things that I think is really important is something called popular education, where we kind of learn from each other and from our own experiences, because that information is really valuable. And there's a lot of knowledge that can be gained from each other that's not necessarily about facts or statistics, but about experiences. So we're gonna head into breakout rooms for about 8 minutes. And you're gonna just, since we already did introductions, maybe just put your least favorite food in the chat for each other. And then we're gonna answer 3 questions, which is, how have you seen your community affected by lack of healthcare? Have you seen a lack of healthcare disproportionately impact marginalized communities? And what steps can be taken to improve the current state?
And then I'm throwing those in the chat real quick, but I won't let me copy and paste.
And then once we're done with that, just one person will report back once we come back to the main session. Are there any questions about that?
I'm just trying to get those in the chat for y'all real quick.
Awesome. Thanks, Lauren. I can also broadcast those out to the rooms once everyone is assigned.
Oh yeah, that
So
would be
popping
great.
those in the chat would be awesome.
Okay. Then everyone just go into your breakout room and you should have already received the invite. You're still sharing your screen. And then we'll see you back here in about 8 minutes.
I'm moving you guys to room 4, sorry.